It's great to be joined by the Chief Medical Officer of Health of Ontario and York's Medical Officer of Health as we get out in the community to thank the immunization teams across Ontario supporting students, parents and education staff as we work to increase our rates. We have one of the highest rates of immunization for high school children. We are working together to increase that for elementary children. As you know, there are clinics in communities just like this one in Markham stood up by York Public Health, and we have over 184 clinics specifically focused on schools being stood up over the next week and a half in the month of January to increase access for parents, reduce any barriers, and increase those rates of vaccination to make our schools as safe as possible. And that is supported by the deployment of 3.9 million rapid tests that are now with our schools and being sent home to our parents. That is a positive, in addition to the high-quality N95 masks for staff, along with high-quality 3-ply masks for students. And of course, the enhancement of screening and cleaning, all of which is designed to reduce the risk of transmission within our childcare and our school settings. And I want to thank everyone at home for their collaboration and vigilance, and most especially thank our local teams on the ground here in York and across Ontario for helping to support the immunization campaign and get it to every family that wants a vaccine. And with that, Jamie, I'll just turn it over to the Chief Medical Officer for a quick comment, and then I'll return.
Okay, thank you. Doctor, real quickly, Doctor, is there a threshold for a school to close a school? I know that each individual unit can close a school when they deem necessary, but wouldn't that be better for a top-down if there's a threshold and there's a way of knowing exactly when your school is going to get closed?
Oh, thanks for that question. So our job is to make our schools as safe as they can be. So very happy to be here at an immunization clinic where we've now achieved 52% of those from 5 to 11 have had their first dose, and around 10% have had their second dose across Ontario. So that's brilliant. We'll work together with our local public health agencies and our school boards to monitor that absenteeism. And if the rate suddenly rises 30% above their baseline, we'll have communication, which may include closure, may include further augmentation of the safety protocols within the schools to further keep them as open as they can be. I mean, that's our goal, is to keep our students learning and to catch up on their mental, physical, social, and educational needs. And we'll be working at a local level to try our best to keep our schools as open as possible.
How many schools are closed right now?
I don't have that number at my fingertips today. I'm sorry.
Okay, that's fine. Then the Minister of Education, please. Thank you, Doctor.
No trouble.
Thank you very much. Yep, sure.
I don't have any schools closed. Okay.
16.
The people that are working in this building, this is just not healthcare workers.
No, absolutely. We've got great partnerships here. We've got our municipal employees who are helping out with registration. We've got our nurses, supervisors, we've got pharmacy techs, and we've got some physicians as well who are immunizing. So it really is a group effort. And it's a beautiful facility. If you haven't been here and you live in the area, it's a great opportunity to see this relatively new facility. And it's a great place for kids and all adults to be vaccinated, in and out really quickly. And hopefully convenient for everyone, and there are points available right now for anyone who needs one.
Perfect, fantastic. Your name is?
Dr. Pakes.
And you're with?
I'm the York Region Medical Officer of Health.
Perfect, thank you very much.
Okay.
Minister.
Yes, sir.
The resolution for finding out if your school is open or is opened up a lot today, and you can find out whether the absenteeism at your school. What do you hope to achieve by having that information?
We want to increase information access to parents during a period of uncertainty around the world. We want parents to have greater knowledge about the rates of absenteeism in their schools, keeping in mind that families today in this province, unlike all in the Federation, have access to rapid tests on a weekly basis being provided for symptomatic purposes, so that parents at home not only could check online to see the rates of absenteeism, but if your child gets a symptom of COVID, you now can immediately take action in your home within minutes, having access to an answer, and 24 hours later, to be sure, a second rapid test would be done. Upon 2 negatives, symptoms subside, we can get your child back to class, which is important to keep them in class learning and to reduce the learning gaps that have emerged over the past 2 years. So information, rapid tests, high quality masks, and of course a continuous focus on improving ventilation in Ontario schools is reducing risk. And that is what our goal has been since the beginning. And we've built in new layers of protection with the use of rapid tests, additional ventilation improvements and HEPA units, and obviously a stricter screening program, recognizing with Omicron the necessity to take a more sensitive, more comprehensive approach to symptom screening at the front end to reduce children or staff from entering schools in the first place should they have a symptom of COVID.
So how does, I understand the rapid tests, and I understand your symptoms and all of that stuff, but that was happened last week. But this week you're introducing a web page where you can go and find out if your school has a high level of absenteeism or a level. How is that going to help the parent?
Well, it ensures parents have daily access to rates of absenteeism for students and staff within their child's school. It also allows families, with the use of rapid tests layered into that knowledge, that should their child be symptomatic, to be able to take immediate action at home with free rapid tests provided by the Ministry of Education on a continuous basis to families, so that if a symptom arises, which could happen in the month of January in the winter in this country, you should know with confidence. So you have access to 2 rapid tests, which will be continuously replenished for schools in Ontario. All of this, including the enhancements to our PPE, the N95s for staff, the accelerated access to boosters, it's all designed to support in-class learning and reduce risk, which we think is so important. As children get back to class, we want them to stay in class.
Perfect. Okay, and then why are there hard thresholds when a school hits for closing a school? If it's 30% absentee, whether it's staff or the school body, the student body, why isn't there a hard mandate for every school rather than a piecemeal the way it's going?
Well, school boards will continue to work directly with their public health liaisons to ensure that the settings are safe as possible, and more importantly, that there's any concerns related to COVID within that school. Public health will take action. They have been supported by the doubling of public health nurses that we funded in the ministry to help ensure our schools are as safe as possible. And obviously, rapid tests being provided to parents allow parents to make the decision to send their child should they have symptoms. And it also allows them to every single day access the government's website so that they know with confidence the rate of absenteeism for students and staff on a school-by-school basis, which we think will help improve access to knowledge so that they can make the best decisions for their children.
The childcares that operate in, a lot of childcares operate in schools. Will they be included in this data? So if your child is young enough to go to a daycare, but not young enough to, or old enough to attend a school, will they be included in this data?
So obviously we're very committed to making sure our childcare settings remain safe. It's why we have put in place a high quality N95 mask made available to our staff. It's why we have increased the screening at the front end for students and staff before they enter. It's also why we've sent home rapid tests to children in childcare and to staff in childcare. All of this is really premised on a belief that we can and we should reduce risk to keep these settings as safe as possible. They remain open. They have stayed open through the pandemic, and we're grateful for the work of our childcare workers, which is why we've given them accelerated access to the vaccine with our education workers, and we encourage them to come today here in Markham and across Ontario to public health, immunization clinics, to school-focused clinics, all of which are available. They are accessible, and they're being increased, the access is being increased literally in communities small and large in the province of Ontario. So we want staff to step up, get their booster, get their first and second dose if they're not already immunized, and take advantage of the rapid tests we've deployed.
And it's childcare also. We expected an answer by now about funding with the feds. Where are we on that?
We've been working very hard to get a fair deal for Ontario families because we know childcare is too expensive. It is inaccessible to too many families in Ontario. That just simply is unacceptable. And our Premier and government is committed to bringing forth a deal with the federal government that is fiscally sustainable, that actually gets prices down to $10 a day, that ensures women can get back to the labor market and support our economic recovery.
But we've heard that for over a couple of months now. Why don't we have a deal and other provinces have a deal?
Well, we're working very actively, working and negotiating with with the federal government with one message, which is to deliver a deal that provides stability, affordability for moms and dads in Ontario who are paying very expensive childcare. So those discussions are ongoing. They continue this week, as they have over the past weeks, with the single aim of a fair deal for Ontario families that reduces costs and increases access to spaces in all communities of the province.
But then, but I look at it. But that's the same goal that other provinces have, and they have got the negotiations, or they've signed agreements. What is it? A per populace funding per populace? It's catching the hook. Why haven't we got the same deal that other provinces had, who had your same goals, have been able to sign agreements?
Well, we certainly want a deal that is fair for Ontario families, and we believe that the federal government, working with the province, can get there. What we're asking for is for more financial investment to ensure Ontario families pay $10, because we know this province has one of the most expensive childcare systems in Canada. It simply is unacceptable for working people in this province, and that's why we're at the table. We have been for months with the federal government, urging them for a longer-term investment, an increased investment, and more flexibility to support all families and how they raise their children, be it in a nonprofit childcare or an independent childcare. We want all families to receive that benefit, and we are aggressively making that case to the federal government in good faith to land a good deal so that all families could benefit and that we can finally make childcare affordable for families in this province.
You're going to get a lot of heat when people start seeing the number of schools closed, because they're worried that their kid's going into an infectious environment. What do you tell that parent that sees a lot of absenteeism in their school, should they still feel safe to send their kids to school? This is the resolution that you've created in the reporting is only going to create worried people.
Well, we encourage families to continue to follow the leadership and the advice of their local public health unit, who are working very hard to support in-class learning and keeping it as safe as possible. Please use the millions of rapid tests we provided directly to you, the only province to do that. And of course, continue to apply a very stringent screening program every morning before a child or a staff member goes into a school. If we do all these things, we will reduce the risk, and we can build confidence that these settings are as safe as possible. And I want to thank our frontline staff in our schools, of course our staff in the immunization clinics here today, and everyone who's working together to protect schools and keep our kids in class. Thank you so much.